come to depend on your products. Well, we'll focus first on understanding the patient needs. We've really divided our patient categories into two general areas. The first would be occasional use for acute pain, nausea, inflammation management. The other one would be more periodic. So that would be, the first category would be occasional. Periodic would be more consistent, where you're dealing with people with chronic ailments. And certainly going to be focused on slower releases, but higher doses. I don't mean to oversimplify the market, but the reason that I got into the infused products manufacturing business is because I thought putting a fine point on the end user, the patient, the customer, was going to be incredibly difficult, because is it a 23-year-old lift operator who lives in Breckenridge who may have chronic back pain, or is it a 72-year-old female who has lipoma and doesn't necessarily have any experience with raw plant material? At the end of the day, the answer is all points in between. And so our company, in particular Dixie, has tried to create delivery systems, innovative product lines that meet all of those patients' needs. Delivery methods is something that we just talked about. Today, our company, Dixie Elixirs and Edibles, maintains 9 distinct product lines, or what we call internally as delivery systems, representing approximately 65 unique products. The drinks, the edibles. The flagship product is obviously the medicated elixir. It's a 12-ounce, 360 milliliter flint bottle that maintains anywhere from 22 up to 100 milligrams of active cannabinoids. Represents about 35% of our business, and although sometimes people think that the traditional edibles are going away, we're not necessarily seeing that. Pharmaceutical-grade capsules. In August of 2011, we launched our botanicals line, topical salves, that provide no euphoria whatsoever to the end user, the patient. And although it was widely covered in National Geographic's American Weed, which certainly gave us a nice little start, it's probably one of our fastest growing product lines in our company, because the variations of the product are limitless. Tinctures, throat sprays, buccal sprays, transdermals, soft gel caps. Tetra Labs has done an excellent job. I think they're a silver sponsor here. I've had long and active discussions with Dr. Joel and his team. And lastly, certainly edible film strips, which is, I think, going to be a very innovative product line that you'll see from us in the next likely 90 days or so. Understanding the lifestyle of the patients, the needs, if you will, that's incredibly important. Building trust and really meeting the patient's need. We talked earlier about customer service. Chris, in his presentation, welcoming us all in the Medical Marijuana Business Conference survey, talked about it being one of the single primary interests that a patient is looking for when working with a medical marijuana center, or certainly a MIPS like Dixie. Understanding, easy to understand, and compliant labeling is something that we have focused on since day one. Our packaging has been difficult from day one. I mean, the only thing that was consistent in this business was change. And so you go out and invest $10,000 in what you think to be the most slick packaging, and then you get a note from the Medical Marijuana Enforcement Division that says, that's not going to work, we're going to need this. That's $10,000.